Good morning and welcome back to Valley News Now. I am Adam Shalafu, and we got a full house today. We have Jen Eliassen and Chandler Esslinger, and both of you guys do a lot of work for the city, do a lot of work for the area. You do some work separately, you do some work together, and I want to first provide you guys an opportunity to introduce yourselves and tell us about the work you do.
Great, yeah, I'm the Director of Harm Reduction Programs for Fargo Public Health, which is also part of the city of Fargo. It includes a number of different things, for example, Gladys Ray's shelter, mobile street outreach and mobile outreach, and winter warming's part of one of my responsibilities.
Thanks. Thanks, Adam, for having us here today. I am the brand new Executive Director for the Fargo Moorhead Coalition to End Homelessness. And if people are a little unfamiliar maybe with what the coalition does, I'd like to share that, the vision that the coalition really works to achieve is to work in partnership throughout our region to achieve permanent solutions to prevent and end homelessness. And so when we talk about preventing and ending homelessness, we really mean something specific. And so preventing homelessness whenever possible, and then ending homelessness means making it rare, brief, and one time. And so right now, the work of the coalition really looks like partnering with over 70 member organizations across the metro area in Cass and Clay counties, and working together to figure out how do we meet some of those short-term winter sheltering needs, winter warming being a crucial part of that, and connecting that with some of our long-term goals for increasing access to housing and ensuring everybody has a place to live. So.
And the key word you guys both bring up, winter warming. So we're going to be talking about that project today. Homelessness, obviously, an issue not just here but nationally that we could talk about for a very long time. But we're keeping the focus today on the winter warming initiative. And so let's just start with that. Tell me a little bit about just a general overview of what that initiative is.
Sure, so it's in response to the increasing numbers of people who need shelter in the community. Now, winter warming is not a shelter itself, it's just a space for people to be safe, be warm, get out of the elements. But we know that every shelter bed in the community has been full for a really, really long time, and that leaves a number of folks out there without any options or without alternatives. We do work really hard on trying to get folks into any potential options that are out there, but in the end, we have too many people and not enough shelter beds.
I think just, from the perspective of the coalition, it's really important to consider the role that the entire homelessness response system plays in ensuring that there are enough resources available for everybody who needs them. Winter warming is a crucial part of ensuring that we have a diversity of types of shelter and non-shelter availability in the winter time to meet people's unique needs. So some people will find success in a traditional shelter setting, some people will have better success at the Gladys Ray, and some people will need to use the Winter Warming Center. And so ensuring that we have that diversity of options to meet people's unique needs is kind of how we're responding to that need for shelter and warming space throughout our community.
Right. And I feel like you guys touched on this a little bit, but I want to talk about the different goals and how you look to address those goals and have an understanding for, what is maybe a common need versus what is going to be a need for the different individuals. Every person who you might help, I assume, would have individual story, different background, different needs. So how do you guys kind of look to balance that and take aim at the needs as a whole?
Sure. So every program that we have under harm reduction at Public Health is about engagement. Our role in the system that Chandler's talking about is about connecting people to the services that help them reach whatever goal they identify. And winter warming is not any different. Everybody has unique goals. They have different places that they want to get to at a different pace, I guess, for each person. It depends on really, where they're at in their own planning and effort to get out of their situation. So our job is to engage with them, build a relationship that allows conversations to take place, and ultimately help connect them to the resources that should assist them with getting out of the situation. So overall, obviously, the overall need is a place to be during really cold weather. And we try to take advantage of any time we spend with any individuals to hopefully help them resolve their situation.
Yeah, and I think, all of our shelters and winter warming spaces have kind of a niche population that they tend to serve. So we know that some shelters only serve single adult men. Some serve families, some serve families and women fleeing domestic violence, some serve youth. And so the niche population, how this kind of fits into the needs of the overall system, is that winter warming and harm reduction really get to focus on the folks who are unsheltered in our community, so living outside, and also folks who are chronically homeless, so people who've been experiencing homelessness for a long time and maybe haven't seen success in some of those other shelter options and really find their needs being met in harm reduction and winter warming or at the Downtown Engagement Center. And we need all of those different options to meet the needs of people in our community.
Now, the Winter Warming Center, located at 1230 25th Street South in Fargo. The center was previously at the Downtown Engagement Center, and I believe we have some video I'm going to pull up here. And if you don't mind just kind of walking me through some of what we're seeing. It looks like some pretty nice amenities here.
Sure, it's amenities, I guess. It's we could call them amenities. Ultimately, what it is just a basic airport model is what it's referred to as. There's comfortable chairs for people to hang out in. There's bins for folks to put their belongings. We really just try to keep a calm, quiet environment so that people can, to be clear, it's not an ideal situation.
Right.
In an ideal situation, people would have a bed to sleep in their own homes, though, and until we get there, this provides people with a comfortable and safe place to be where they can be by themselves or they can connect with staff or whatever they need to. We really want to make sure they feel that their things are safe, that they're safe, they have some options for activities while they're there. Might be watching a little bit of TV or playing cards or whatever the case is. It's a very quiet environment.
Very good. And operation hours, what does that look like for you guys?
It's 8 p.m. to 8 a.m. right now. We start out at the engagement center where there's intake and we're kind of trying to figure out who all needs to be where, and then we move on over to the facility on 25th Street.
And you mentioned earlier that this is not a homeless shelter, so
Right.
no beds available. But it looks like definitely, like you said, some places to rest, some places where people can spend some time together. What else is available for the space here?
Well, we have a little bit of everything, I guess. People have an opportunity to have some tea, water, other snacks. We don't want anybody to go hungry for 12 hours. However, we don't provide full meals either. It really depends on the person. We connect with folks. We talk with them if they want to. Some people sleep, sitting in a chair all night long. And when they return to the engagement center, that's where they really access more services like showers and laundry and meeting with a care coordinator or one of the staff. But again, our goals at this place is just to make sure people are comfortable and safe until we can find an alternative.
I think too, when shelters are full throughout the community, and as we know, resources are limited in many ways, it's important for all of our partners to figure out how do we maximize the number of people we serve while keeping everybody safe and being a good steward of our resources. And so the Winter Warming Center, I think, is a really good example of doing the best we can with limited resources to serve as many people as possible. And Jan touched on this a little bit, but I also really want to highlight the kind of triage and diversion period that happens at the Downtown Engagement Center from 5 to 8 p.m. So people who are looking to present for winter warming can come and get an intake, and then a staff person can help assess if there are any other options available in the community. And I want to highlight that specifically because that's when we engage the rest of the homelessness response system. We're reaching out to the other shelters and saying, okay, now that you've kind of got your numbers for the day, do you have one or two shelter beds that have opened up? And those immediately get filled. And so we're really maximizing all of those resources across the community, ensuring that no shelter beds go unused on any given night, and the people who are most appropriate for winter warming end up there. And so it really is about that continuum of providers working together, with the engagement center and winter warming being a really crucial kind of nexus and an access point for people in our community.
As far as people who are eligible to enter, what goes into that?
Well, again, it depends on their needs. We try to make sure that people are in the right place to meet their needs. If it's, for example, somebody who's really young, we want to make sure we get them connected to some of the youth services and youth shelters and so on. Otherwise, it's just behavior-based. You know, we're a low-barrier facility, which means that people need to be safe. They can't be a danger to themselves or others, and that's really what the requirement is to get into any of our facilities. But the folks that go to winter warming, they do much better, I guess, in an environment better than what they would do at the Gladys Ray, for example. There's a lot of the Gladys Ray is much smaller. It's much busier. Some of the people that don't go to shelters, it's because they don't like that congregate setting. And I think that we have this beautiful space for winter warming that's much larger, and it feels a little less intimidating, I guess, for some folks. So it really depends on what we know about them and what we think, where we think that they'll do best. Sometimes we have to change that, you know, it depends.
And there are some occasionally behavioral health concerns, mental health concerns. How do you guys navigate those kind of challenges?
You know, we utilize all the resources in the community. Southeast Human Service Center has some crisis response options for us. It really depends. It's situational. If we can help somebody just stay in a good place and stay calm until the next day so we can connect them to workers that they already have a relationship with, then that's what we do. It's unique.
I also think it's important to talk about just how every staff person who works in the homelessness response system is a highly skilled and highly trained person who can navigate and manage a lot of those different crises, and is a lot of times just through engagement able to de-escalate whatever situation may arise and then continue to connect that person with the appropriate resources they need. That is especially true of the folks at the Downtown Engagement Center and who work in winter warming. They're seasoned staff who a lot of times have relationships with the people who are being served there, but it's true across the system. And so, you know, these are folks who have really dedicated their lives to being experts in serving people experiencing homelessness and helping them move on from their situation. So they've seen all different types of situations and are just familiar with how to navigate that. So I want to give a big kudos to everybody who works in the homelessness response system, who serves these individuals every day, because they're well trained, they're good at what they do, and they're meant to do this work in our community.
And do you mind just sharing some success stories, if you will, about people who have been able to, you know, get the help they needed and then get back into more, I guess, less dependent member of society?
Yeah, you know, I'll share a couple things, and then Jan has years of success stories. But I think one thing that people need to know about our homelessness response system is that we're actually housing people more efficiently and more effectively than we ever have before. We are really good at connecting people with the resources they need. The struggles that we have is just there are more people who are experiencing hardship and homelessness in our community, and we don't necessarily have all the resources we need to help everyone. And so, you know, one of the connections when I was working really closely with Jan's team in street outreach is that we were actually able to, Carissa, the mobile outreach and street outreach coordinator, was able to connect with people who are living outside and actually house people directly from some of those homeless camps. And those are the success stories we want. We want people to move from the situation they're in directly into permanent housing. And then the things that people are able to achieve once they have the stability of housing are truly incredible. I think sometimes we can have this stereotypical view that folks don't want to continue improving their situation if they have that stability of housing, but we actually find the opposite to be true. People are more capable, more motivated, and more able to attend to those other areas of their life that need stability when they have that place to live. And so those are some of the values that kind of underscore the entire homelessness response system. I'm being a little vague because I know Jan has good stories, but that's kind of the overall kind of success that we tend to see because our system works so well.
So yeah, I don't even know where to start with that. We've seen a number of people move into housing and really achieve their own goals for recovery and sustaining housing and living the life that they've wanted to live but had a hard time getting access to. So, you know, some of the some of the stories really just involve people who were unfortunately camping, they were hanging out on the streets, they were sleeping in parking ramps, all of those situations that, you know, sometimes get a lot of attention, right, around the community. Those folks once housed, we don't see them doing those things anymore. When you have a safe place to be that's your own, that you have control over, of course, it feels better and people do much better. We have supports that go in. We want to make sure that people feel supported in any environment. And I think that's a really important part of how we do housing, I guess, is making sure that there's the right supports. We don't provide all of that. We have community-based partners that do a lot of that. But over the years, I've watched how supports have become more and more available, and I think with that, we've seen some people who a lot of folks did not think would do well in housing. We've watched them do very well in housing just because of those supports and hanging in there with them until it feels more doable, I guess, for those folks.
Sounds like just kind of starting with the baseline of needs. You know, people talk about, I think it's Maslow's hierarchy of needs, shelter, food, pretty important ones. And then once you get those addressed, hopefully people can start to stimulate change.
That's exactly right. It's if your most basic need for a safe place to exist isn't met, it's really tough to go after and meet the needs that are a higher level.
Very good. Well, let's talk a little bit about the capacity and the limitations within that, because I know there's got to be some challenges, and you guys touched on them a little bit just now as well.
Limitations in getting people housed?
Just limitations, space available, I mean, whatever other limitations as well.
Well, again, I think that all of the shelters in our community have to navigate the limitations each and every day. We have people showing up that really need some place to be. Sometimes they're folks who found themselves without a place because the place they were staying, they were asked to leave, or you know, they weren't in control of their own access to someplace safe. So, you know, we all have to work together. We all have to navigate this shortage of space each and every day to make sure everybody's inside. The other shelters also really try to stretch their capacity as well, and sometimes it's, you know, a chair in any of the shelters. Some places just a place to be so they're not outside. Or not in a car, or whatever the case is. So there's, I mean, limitations I think are endless just because it comes down to not enough space for people to be in the immediate and not enough housing for them to move into to get out of that situation in the first place.
Yeah, I think that was great, Jan. And I think, you know, part of what winter warming is in terms of the capacity of our overall system and the limitations, the Winter Warming Center was really in response to the fact that we do not have enough available shelter in the community. So again, how do we meet that need, meet people where they're at, get them connected to the appropriate resources, keep them out of the cold, and just ensure that we're doing the best we can to be good stewards of those resources and maximize the number of people we can serve. And that's just what the harm reduction team is really good at, and it's what the rest of the system is trying to do every single day.
I think one of the things that's important to point out there too is Chandler often talks about how we're at a position in our community where things aren't as complicated and as problematic as they are in other communities. I don't know how you want to refer to that part, but you know, we're at a great position. We have everything that we need to start moving forward and getting people out of this situation altogether. We don't want to keep figuring out how to have winter warming and how many chairs we're going to be able to have. We want people to move into housing so that we have less and less need for this kind of thing. And I know that can happen in our community because we have what it takes.
Thanks for prompting me there, Jan. Yeah, it really is about making sure that we are addressing the short-term needs of our community, which is absolutely ensuring that everybody has a safe place to be, no one's left out in the cold, and also connecting to those long-term solutions, which is housing. And so kind of what I like to say is that we are really one of the precious few communities left in the nation who has the opportunity to turn back time on homelessness and make sure that everybody in our community has a place to live. It takes resources to do that, but we are well positioned within the coalition and with our partners to have the collaboration necessary to achieve that goal. We just need support in executing on the work we already do really well and scaling that up to meet the need. And so it's certainly not impossible. It does take investment, but we are well positioned and well poised, just kind of waiting in the wings for those resources to come in so that we can continue to deliver on that long-term goal of no camps outside because someone is forced to be there because they don't have any alternatives, and everybody has a place to live.
And I know that the City Commission recently voted to use the remaining funds from American Rescue Plan to fund the continuation of the program this year. So it sounds like City Commission doing what they can to help. Like we said even before we started the interview, you know, it is almost a group project, the group being the whole community. Obviously, you guys are some of the spearheads for this. But what kind of help does that allow you guys to get when you get that kind of funding and support from the City Commission?
Yeah, you know, I think any time that we can deliver on those best practice evidence-based solutions that we know improve and decrease the rates of homelessness in our community, that's what we want to see. Getting funding for winter warming in particular allows us to continue to stay engaged with the people who need those resources and support. That relationship building is a huge part of ensuring somebody's on a path towards success. And then I think, you know, we really just have, again, this really unique opportunity. And so there are so many different roles that individuals, businesses, organizations can play in supporting that. And so if you are listening out there right now and you're wondering how you can get involved, please reach out to us at the Homeless Coalition. We can help identify and match you with your whatever interest you have in supporting that work, whether it's financial, whether it's with time, whether it's something else entirely. We can help figure out exactly how best to leverage your resources and your talents and time to help support that overall goal. But it really also does come down to ensuring that our local organizations have the resources, the funding, the staffing they need to help as many people as possible and keep them permanently and sustainably housed. And so that's kind of that long-term goal, and it does take all of us to come together. I think one of the great things that Jan and I have both seen over the past few years, especially as this conversation has continued to grow, is that there seems to be widespread agreement that something needs to be done in order to end homelessness. It doesn't really matter why you feel that way, but let's commit to those best practice evidence-based solutions that exist within the homelessness response system to make that happen.
Very good. And now you guys have some statistics here from last winter. Let's kind of go over some of these numbers and tell me about how you guys can use some of these to address the anticipated needs of the winter that we're experiencing now.
Right. We weren't completely sure what to expect last year when we opened winter warming, and we certainly did. One of the things that we learned is there were far more people in need of a warm place to be each night than we expected there to be. So that was, I think, the most significant lesson learned right away. So we've tried to be more prepared this year by having a little bit larger space. You know, I don't know that beyond that, we have to navigate, how do you keep people comfortable when you have like an airport style facility? We know that, you know, generally from an outside perspective, it looks like not a great response. It looks like we could be doing more. We're trying to do whatever we can to make sure people stay safe in the moment, stay safe at night. We want to sock all of our money into housing and the programs that are going to lead to housing. And so let's just keep people safe, engage with them, and then start investing in the places that they can go to get out of the situation. We learn every single day that there's people who have needs that we did not anticipate. And the beauty of that, though, is we have a great community and we're able to meet those needs typically no matter what they are or how unique they are.
I think just in hearing about kind of what the Winter Warming Center saw in terms of numbers last year, there were a few things that really kind of spoke to me in terms of the need that's present in our community. There were over 700 unique individuals who presented for winter warming services last year. And I think that was very eye-opening to all of us, considering the fact that the shelters are currently full. So that just kind of speaks to the need, the capacity need in our community. And then I believe it was about 90% of people who presented for winter warming were there for 10 days or less. Yes. So we're really talking about this short-term period of time where people find themselves without a place to be and need somewhere to go that's predictable, that they can count on. And that's really the gap filler that winter warming is able to provide. And so those are, I think, really great data points that help us think about what are the additional needs in our community, and really investing in that data-driven decision-making because we have some really strong numbers about the need and about what types of people and circumstances they're entering winter warming for. So that was eye-opening for me.
Very good. I want to ask, just kind of generally speaking, and encourage both of you guys to share your answers here, but I want to hear about your why. I mean, this is a topic that is important to a lot of people throughout the community, but why do you care so much about the work you do? What motivates you to show up and look to solve these issues each day?
Wow. So I show up every day because I believe that people deserve more than living outside or living in camps or even living in shelters. We know that housing is a human right. But beyond that, I care an awful lot about my community. I live in Fargo. I want everything to go better in my community. Homelessness costs a ton of money. Keeping things the way they are now is incredibly expensive. It's far more expensive than it is to just house everybody and provide the supports. So we continue to invest in a reaction rather than solutions. So I believe that by showing up every day, all of us can help influence that and talk about, the savings financially, but also, the impact that homelessness has on people that don't have a place to live, but also on the whole community. Everybody pays the price when people don't have access to housing. And so I go because I believe that we can get there. I truly believe that we can end homelessness. I know not everybody believes that, but I know that we can show folks. I know that we can say "I told you so" once we get there.
I think my motivations are very similar. I have a lot of hope for our community. I also know and believe that ending homelessness is possible. This is a solvable problem, and our system is really well designed to do that. And I think I love this community. I've lived in the Fargo-Moorhead area for the last 13 years. I feel like I belong here, and it's my personal kind of vision and belief that we can ensure that Fargo-Moorhead and our metro area is a place where everyone belongs and everyone has a place to live. And so my role at the coalition is really leveraging all of those partners to help us achieve and deliver on that goal.
Very good. Well, before I let you guys go, I want to give you one last opportunity to share any closing remarks or anything that perhaps I missed throughout the interview process that you want to use the platform to speak about.
Thanks, Adam. I just really appreciate the opportunity to share a little bit more about the FM Coalition to End Homelessness. If people are interested in learning more about the coalition, you can visit us at fmhomeless.org. If you're interested in getting in contact with me specifically, you can reach me at chandler@fmhomeless.org. And we live in a compassionate community where people want to help and people want to see people's lives improve. They don't want to see people experiencing homelessness. And so if you feel that you are someone who has a role to play in that, get connected. We can help you identify how best to support that goal, that mission, and those services. And that's really my hope for this opportunity today.
I don't know what more I could add to that. That was a great answer. It's, again, call the shelter that you have worked with in the past. Whoever you want to support, call them and find out how you can support them. That's one of the biggest challenges we have is we don't always know what type of support people want to provide. They don't always know what types of support we need. There are times when we need toothbrushes and snacks, and there are other times we need socks and jackets. And so just call and find out what people need. And winter warming is no different. We try to make sure that they have everything they need to meet basic needs like that as well.
Very good. Well, thank you guys so much for joining me on the desk here today. And that's all for now. Thank you guys. And we'll continue to check up on the work that you guys do. Good luck continuing your work on this initiative and beyond. And thank you all for tuning in on Valley News Now. We'll see you next time.